Neuropathic pain is a chronic and often debilitating condition that arises from damage or disease affecting the somatosensory nervous system. Unlike typical pain, which results from direct injury or inflammation, neuropathic pain is rooted in nerve dysfunction, leading to symptoms such as burning, tingling, numbness, and electric shock-like sensations. This condition can significantly limit mobility, reduce independence, and negatively impact overall quality of life. Common causes include diabetes, nerve injuries, and conditions like trigeminal neuralgia or postherpetic neuralgia. Despite its prevalence, neuropathic pain remains challenging to treat due to its complex mechanisms and varied patient responses. Understanding the underlying biology, such as neuronal hyperexcitability and impaired inhibitory pathways, is crucial for developing effective individualized treatment strategies. In this video, we'll explore the latest therapeutic approaches that target these mechanisms and offer hope for better pain management. Managing neuropathic pain often begins with pharmacologic therapies, each targeting different aspects of nerve dysfunction. Serotonin-norepinephrine reuptake inhibitors (SNRIs), such as duloxetine and venlafaxine, work by enhancing the brain's natural pain-inhibiting pathways. Tricyclic antidepressants like amitriptyline not only boost these pathways but also block certain nerve channels to reduce abnormal firing. Gabapentin, a widely used non-addictive option, calms overactive nerves by modulating calcium channels, offering relief for conditions like diabetic neuropathy and postherpetic neuralgia. Non-steroidal anti-inflammatory drugs NSAIDs and acetaminophen are also used, though they are more effective for pain with inflammatory components rather than pure neuropathic pain. Each drug class comes with its own benefits and risks, such as gastrointestinal or cardiovascular side effects with NSAIDs or sedation and dizziness with gabapentin. Selecting the right medication depends on the patient's specific condition, underlying mechanisms, and risk factors. Patients who do not achieve sufficient relief from oral medications, topical and interventional therapies provide valuable alternatives. Topical agents like lidocaine and capsaicin patches deliver targeted pain relief directly to affected areas, minimizing systemic side effects. Lidocaine works by blocking sodium channels in peripheral nerves, while capsaicin desensitizes pain receptors, both offering relief for localized neuropathic pain. Ethol, another topical option, activates cold-sensing pathways to dampen pain signals. When pain persists, minimally invasive procedures such as corticosteroid injections, nerve blocks, and radiofrequency ablation can be considered. These interventions interrupt pain pathways or reduce inflammation, providing temporary to prolonged relief, especially for conditions like joint-mediated or facet-related pain. However, each approach has its own limitations and risks, making careful patient selection and individualized planning essential for optimal outcomes. The complexity of neuropathic pain means that no single treatment works for everyone. Modern management emphasizes a stepped, multimodal approach, starting with low-risk oral or topical therapies, progressing to targeted injections or nerve blocks, and reserving advanced procedures like radiofrequency ablation for refractory cases. Future directions in neuropathic pain care focus on personalized medicine, using genetic, neurophysiological, and imaging biomarkers to tailor therapies to each patient's unique pain profile. Emerging regenerative and neuromodulatory interventions, such as stem cell therapy and platelet-rich plasma, are also under investigation as potential alternatives to repeated steroid injections or nerve blocks. Ultimately, integrating advances in research with clinical practice will pave the way for more precise, effective, and long-lasting relief for those living with neuropathic pain.